So there's plenty of evidence in the research literature to substantiate integrated treatment models as having better long-term outcomes than either what we would call serial treatment. So let's use an example of a person who has a heroin use disorder and binge eating disorder and PTSD, right? Or an alcohol use disorder and bipolar type 1 with psychosis. We know from that literature, particularly and early on in the substance co-occurring literature, that treatment programs that address trauma, that address mood disorders at the same time as they're addressing the substance use disorders have better long-term outcomes than treatment programs that do it serially. So, okay, the most important thing, you're coming in day one, we're gonna focus for the first 30 days, 60 days, 90 days, a year on your substance use disorder, and if you can stay sober for a year, then we're gonna address the trauma. That's called serial treatment. There's also treatment in parallel, where a person might go to one unit for their substance issues and then another unit in parallel using a different model for their trauma. And when you look at integrated treatment, it's treating the person, all of the facets of their illness, with a unified treatment model under the same roof in the same setting. And that's what we do at SunCloud. And that's why we do it. One, it's research, it's evidence-based. Two, patients experience themselves more as human beings and less as a disease. So the identification with the disease becoming part of a person's identity is sort of dispelled by our treatment model and our approach. It's a hard thing to do, which is why I think a lot of places don't do it. We invest a lot of time and energy into cross-training. Training programs in the United States are not set up in such a way that they're conducive to having full-grown therapists or doctors who specialize in treating patients in the way that we do. So medical training, therapy training can get siloed and focused on, well, if you want to treat mood disorders, become a CBT expert, or become an ACT expert or a DBT expert. If you want to treat OCD, become an exposure response prevention expert. Training programs aren't set up to really develop clinicians into coming into their professional lives in such a way that they're able to treat a patient that has an eating disorder, a co-occurring substance use disorder, PTSD, and bipolar disorder. So we do a lot of that work here by taking therapists, taking doctors who have specialty in a couple of areas, and then with our team, we become a place that can treat all of the different areas. And those clinicians, by virtue of the supervision and the training that we do here, gain knowledge, gain experience, gain expertise in the areas that maybe they didn't have in their training or in their previous experiences before coming here.